dead or weakened version of bacteria or viruses, and the vaccine rings the body's alarm. It trains the body to recognize and fight the viruses, and then when the body encounters the real dead virus, it is primed and ready to fight for the body's health. And this is the mechanism of vaccines. And vaccines have another benefit for us. Do you know about community immunity or herd immunity? Please tell me, what is it?
It's like you vaccinate all the people of that community. You just vaccinate the percentage of it, and then you get like very good results by protecting people against that specific disease.
Why we cannot vaccinate all of the people in our community?
That's the purpose of that kind of vaccination. It's not necessary. You know, it's more expensive and just.
Vaccine is necessary for all of the people.
But they are already immune.
Yes, maybe they have less immune from another immunocompromised, yes, and then,
They don't need any new vaccine.
for example, when people have chemotherapy or very, very young people, such as infants in such infectious disease, we cannot vaccinate them. And then it's not directly benefit, it is indirect benefits on an immunized person through community herd. This is community herd. In this picture, you see at the left side, if only a few people are vaccinated, then one person is infected, the disease spreads very fast. But if lots of people are vaccinated, then the disease can't spread very far, so the whole community stays safe. This is herd immunity. They cannot spread the infectious disease with each other. Do you know it means herd immunity or community herd. Okay, when should we get vaccinated?
Before any disease. As a prevention, before any disease occurs.
Okay, how old? Which age?
Different for different diseases.
Different by vaccines, different by people, different by situation. For example, in COVID, pandemic COVID, all of the people vaccinated, but infants and children not. Yes? And maybe when all of the newborn get a vaccine, because they haven't any immunity in their body and want to put it then, yes? And maybe adults, infants, newborns, and maybe old people, and in any situation that is pandemic, endemic, and wants to vaccines. And in most countries, okay, when you should get vaccinated? In most countries, you will be given a vaccination card. Did you see a vaccination card?
Yes.
And tells you what vaccines you or your child have had, and then the next vaccination and booster dose you must do and or do. It is important to make sure that all these vaccines are up to date, and you get all of them. These are the
Vaccination card.
vaccines cards, immunization records card. And in Iran, we record it in HER, Health Record System. In most countries, they record in health record systems, electronic health records, and we have immunization records cards too. And effective of routine childhood immunization, you can see in this picture from 1940 to 20, diphtheria, the incidence of those, and measles, and tetanus, and mumps. This is effective of root childhood immunization. And a routine immunization program vary from country to country. Immunization program from country, you can use WHO websites and you can see it there. The routine immunization schools for children and adolescents in the United States are updated annually, but in Iran it's not updated annually. It is updated, for example, every 2, every 3 years, and it's for situation, special situation, and is recommended by CDC or, for example, American Academy of Pediatrics or American Academy of Family Physicians or American College of Obstetrics and Gynecologists about situation. And this is one recommendation immunization program for children aged 2 through 6 years in the United States in 2023 years. And you can see the first vaccine at birth, 1 month, 2 months, 4 months, 6 months, 9 months, 12, 15, and this one. And this is the immunization program of Iran. Again, at birth and 6 years. And this is immunization program in Iran, in Pakistan, and in Lebanon. I want you search your immunization program, your country immunization program, and tell me what is the difference your immunization program, your country immunization program by Iran, with Iran. Search the immunization, your country, Pakistan, India, search it, now search it and tell me.
Hannah, what should we study for exam?
English.
I can understand.
What should we study for exam?
Exam
Exam, امتحان.
for this
For
class.
this.
Yeah.
بچه رو هماهنگ کنم با دانشکده‌تون دیگه. حالا ببینم که چجوری اصلا کلا اگزمتون رو من قرار بگیرم یا کسی دیگه بهتون خبر میدم. Who is your class? You?
Chief.
You, chief, you.
آره.
با چیفتون so I talk to your chief and then tell me.
سریع دکان ها چند بتمن کامل می‌بینم.
Benim karşı.
Gülüyor hadi.
Konu bakalım.
BCG,
Ticka लगाने की उम्र.
BCG, hepatitis B, CPV, BCG and HPV.
After baktım ne?
Hadi hepatitis B vaccine नहीं है.
Konu BCG नामता आना तो. 8 बार. ठीक है यार सही है.
But hadi the hepatitis B vaccine में दिल्ली से पहले ही कहाँ आती है?
BCG
कहते हैं
फौरन बाद ये
बाकी 6 week मतलब 2 months. Same 2 months में हमारे पास.
2
वो पिछले
6 week 2 months.
बेबी
बताया
नहीं,
वो
इसमें-
मत दिया करो.
हाँ,
6 week
PBV
PBV1, Pentagon and
6 हफ्ते बाद में
DTP, HIV, hepatitis B. वो 4 months
रोटा
पे.
वायरस लगा था.
तो 4 months पे. पता है.
ये यार सेकंड मंथ लगा से रोटा वायरस में ओपीवी ता आते बहुत आमद है इसका सेम ही.
Okay. At the birth, what's difference with Iran
Same.
program and your
Hepatitis-
country?
Hepatitis B
Hepatitis
is in
B.
Iran
Yeah.
but not in Pakistan.
BCG is in Pakistan and
Same,
Iran,
yeah.
same.
Same.
Hepatitis B,
Not in Pakistan but it's present in
OPV
No.
is oral
Same
poliovirus,
poliovirus.
oral. It's one of the vaccine that the root is oral.
Same vaccine.
Yes. Same.
Yes.
Same. 2 months.
2 months.
We
रोटा
have
वायरस
pentavalent in Iran. Pentavalent have 5
वो भी हमारे
vaccines, which
Diphtheria, pertussis,
Yes.
hepatitis B,
Haemophilus influenza,
Influenza.
bacteria, and hepatitis. 5 vaccine, 5 different viruses and bacteria in one vaccine. It's named
Tetanus.
pentavalent.
tetanus, pertussis.
Do you have it in Pakistan program or not?
Yes.
Yes.
pentavalent.
Yes, pentavalent.
Yes.
And another country pentavalent India at 2 months. Yes? Okay. 4 months
4 months.
is same or not?
OPV
Yes?
Same.
everyone same.
Pentavalent, OPV and IPV.
IPV नहीं हमारा.
Polio is a vaccine
For many
and
things.
it has two routes,
Again,
oral
Again
and
OPV हमारे
injection.
वाला OPV.
This is IPV, OPV and IPV. In Pakistan and India, OPV and IPV same?
Yes.
Yes. We have one additional rotavirus. Rotavirus which is patches
different type है.
diarrhea.
Rotavirus. In Pakistan, rotavirus, yes?
Yeah.
School children.
But in
especially.
Iran, we haven't rotavirus. You have it. India rotavirus, yes, but we haven't. 6 months,
6 months चला आता है. OPV 3.
OPV is same.
Penta.
Pentavalent
same?
no.
pentavalent,
No.
no.
Daniel. Tam 14 kadın tam.
Nanti bazı çizgiler tıklanında de mekanizm yaşarken çevrene var.
You are from India and Pakistan, not another country.
Iraq.
Iran. Is same? Same or not?
We are much like same Iraq. Whatever service in Iran, we are same thing in Iran.
Okay, 9 months.
Measures in Pakistan but in Iran
In Iran, nothing. 12 months.
Week के बारे में 1 month में
Same. MMR is 3 viruses.
Measles,
Measles,
mumps, rubella. Mumps,
Rubella,
mumps.
mumps.
months measles
Yes.
और rubella.
18 months.
18 months.
Measles.
OPV plus hepatitis A Pakistan.
You just business, yes? Nothing. But we have DTP, OPV, and MMR. And 6 years, we have OPV and
OPV chicken pox.
DTP.
Pakistan chicken pox.
And school time.
It is a
ये पोलियो पास का पता नहीं है. पास का पता नहीं है.
पास होता है.
ठीक है.
पोलियो
पास होता है.
जी का 18 में देखो.
We haven't rotavirus in Iran or pneumococc in Iran. In program, we can find this vaccine in pharmacy and in private setting. But for program, for the program immunization of my country that get this vaccine free, no, we haven't these vaccines. Because the vaccine program is free in all countries, in America, in Iran, and in all countries.
एक का अच्छा क्या है? Vaccination program.
Okay, before we go to another topic, is vaccine cold chain? We don't know. Vaccine cold chain is a procedure and is the rules that when a vaccine leaves a manufacturer from manufacturer to vaccine outreach,
Allergy हो गई.
this process
अच्छा बिल्कुल ठंड आएगा.
must be in cold situation.
अच्छा.
बिल्कुल.
हाँ yes.
Yes? And its name is cold chain. It is very important in all countries. Because if this cold
Sorry
chain
लगता है मुझे.
is not
Allergy center ना था.
by rules, by this procedure, by ultra cold temperatures, the vaccines is not work perfect, and the disease happen. Because this process make good and perfect, we have the rules. For example, in Iran, we have some special refrigerators in our healthcare center that if the temperature is up or down, it alarms. And it alarms to a telephone number. For example, healthcare provider or someone who is the who can
Caretaker.
come and then save these vaccines. Yes? And this is very, very, very important. Now, these days, we have measles outbreaks, unfortunately, in this area. For example, Iran, Iraq, Pakistan, Afghanistan, and this may be because this process is not good. And we have measles disease in under 1 year because we have
Change the temperature.
something in health immunity, in community immunity. And because of this, this process is very, very important in our country, such as in Iran. When we want to get vaccine or put vaccine to someone, we must have ice bag and vaccine on it. Because of this cold chain, and this is a mapping the vaccine cold chain. Okay. The cold chain is a set of rules and procedures that ensure the proper storage and distribution of vaccines to health services from the national to the local level. The cold chain is connected with refrigeration equipment that allows vaccines to be stored at recommended temperature to maintain their potency. And when we want to injection, some vaccines injected under 12 months. You can see on this slide. For example, messenger, hepatitis B, oral OPV, or pentavalent, and another vaccines. And in this situation, the patient's position is very important to injected correct and by less side effects. For infants under 12 months, held by their caregiver during injections, skin-to-skin contact is preferred to infants younger than 1 month. And for children 12 months to 2 years, children usually held their caregiver during injections. And for children 3 years and older, they can sit it during injection and they may be held by their caregivers. Adolescents up 12 years and young adults may be seated or lying down during injections. And these are the positions that we can use, suggested positions for holding children for vaccine administration. This is the one position and this is the second position. And we injected vaccine on the arms here. And for infants, we can use this position, this side for administration the vaccine.
Ma'am, why position is important?
Position is important because the body muscle is important to inject it. And for children, for infants, this muscles is not weak enough, and we use this position for this side.
Position skin to skin can take seated.
Yes,
Why these?
because the pain, because the side effects, because we can inject it perfectly, and the injection is, has pain, and to less pain, it is better to use this position for children. And side effects of vaccines. The vaccines maybe have side effects. For example, redness, swelling, soreness where the shot was given, or mild fever, or mild rash, or headache, or body aches.
the skin to skin contact is between the infant and doctor.
What exactly is skin to skin contact?
Skin to skin, maybe put them on your chest, mother chest, or for example, face to face. This is a skin to skin contact in part of the body. Girls, moms, on your chest. This position. Skin to skin. We can use acetaminophen or ibuprofen. Acetaminophen is perfect for eliminate these side effects. For example, fever and rash, and redness and headache. And these are the not serious side effects. Maybe happen after each vaccination and it is not serious. But if the serious side effects happen, we report it and we write and we report it to another organization that we see these side effects from this vaccine, this label, and they follow all of the children, all of the people who get this label, this number of vaccine. And but these are not. If there's serious reaction, for example, lung fever or very, very severe fever or very severe rash or vomiting, severe vomiting, we want to report it. All the healthcare provider should report these serious side effects. And most of these side effects happen with 1 to 2 years of getting the vaccine, but they can happen 1 to 2 weeks after getting the shot for chickenpox or shot for measles, mumps, and rubella. We haven't chickenpox vaccine in our vaccination program. Do we have or not? No, we haven't. But in USA, in Europe, maybe they have a chickenpox vaccine in their program, in their vaccination program. And these side effects do not mean child is sick, just that their immune system is responding to the vaccine. This fever, this rash, this headache, this ache show us that the vaccine is work perfectly, and the body
Responds.
responds and make antibody. And vaccine also sometimes cause more serious side effects than those listed, such as very allergic reaction, but serious side effects are rare. Okay, we have a game now. Do you like game?
Yes.
Yes. Okay.
GTA what?
We have a cross puzzle, and every
3, 4.
three people
Lala,
like
yo, lala.
that it is good. Every three, yes, three answers is game. You, okay. Settle. Puzzle شروع کنید نکردم. از مطالبی که الان با هم دیگه گفتیم. شما چه؟ Thank you. Indirected benefits First dose deposit with vaccine is routinely recommended. A vaccine is given by an injection and orally.
Orally.
You can see on the hepatitis B.
BCG.
اليوم الان لم يتم بيني وما شفتوش وانا غير كل شيء
کوچیکه This is okay. At birth, hepatitis B and pentavalent 5 گانه. ما تو ایران بهش میگیم 5 گانه.
టీచర్
Okay. And down rules and procedures that ensure the proper storage and distribution of cold chain. The name of measles, mumps, and rubella vaccine is MMR. And which vaccine provides protection to child from 5 life-saving diseases? Pental. And this is mild rash. It is a side effect of vaccine. Is it safe or serious?
It's
safe.
Safe. And results within 1 to 2 days. Yes?
बिल्कुल
Okay. The vaccine is injection vaccines have pain, yes? How can reduce this pain? In each age, we can do things and procedures to resolving it and reducing it. We want to review it because it is important for us to reducing vaccine pain. In any age, things you can do to help reduce pain. Doctor, please read them loudly. Yes.
Ask the doctor or nurse about numbing cream. Putting this cream on your child's skin before a shot can help make it hurtless. Give pain relieving medicines. If your child still seems to be in pain after you get home, you can give acetaminophen, sample brand name Tylenol or ibuprofen, sample brand name Advil or Morphine. First, ask your child's doctor or nurse how much medicine to give and how often to give it.
After vaccination, we can use acetaminophen or ibuprofen. Before not, because we want the body responds to the vaccine. If we use acetaminophen and ibuprofen before the vaccine to support the pain, to eliminate the pain, or we want to reduce the pain or fever, it is not perfect and the body cannot respond to that vaccine. Yes? After it, if the a child has fever or pain, we can use acetaminophen and ibuprofen, and we administer acetaminophen and ibuprofen from per kilogram. Yes, kilogram. For example, acetaminophen 10 to 5 milligram per kilogram per dose. Yes. For example, if a child is 12 kilogram, how much we want to administer acetaminophen? That to
120 milligram.
yes, 10 to 15 milligram per kilogram. If the child is 12 kilogram, 10 plus 12, 120 milligram. Yes, and this is the how much medicine to give and how often to give it. We want to calculate it and tell to mother to administer for her child. Okay, less than 1 year. Doctor, please read it loudly. You.
Before the shot, ask about numbing cream. Refer to first row above. Feed your baby breast milk of formula or give out pacifier. If your baby is getting the retrovirus vaccine, ask the doctor or nurse to give it before any shot. The retrovirus vaccine comes as a liquid that tastes sweet. Might help reduce the pain of the shot. If your baby is not due for retrovirus vaccine, you can ask about giving sugar, water before the vaccine. During the shot, feed your baby breast milk or formula or give up pacifier after the shot.
Thank you. And we can use this solution to reduce the pain. We feed your baby breast milk or formula or give a pacifier. For example, we can the mother feed her baby and you administer vaccine. It's not wrong. And this, I think that you don't read these 3 lines. Please read it to after the shot.
पढ़ोले
Feed your baby breast milk or formula are given by Percival. Swaddle, hold or gently rock your baby with pain relieving medicine based on your doctor instruction. Refer to first row above.
This one, the skin to skin contact. Hold, gently rock. Okay,
Hana?
and 1 to 3 years,
what is specifier
pestunak.
means it's medicine
I don't
Good.
know. چی بهش میگن به pestunak چی میگن؟
چیه؟
نه calm میکنه calm
چی؟
specify میکنه
اینجا اینترنت نداره؟ پس به pestunak.
اینترنت داره
چی داری؟
گولزنک. چی میگی
چه؟
شما بهش؟
گلزنک؟
آره سرچش بکن لغتشو
کل
عکسشو بیار.
کل یه دفعه.
چه
Hey, hey.
And 1 to 3 years, please read loudly. You, yes.
Before the shot, after, before which one? The last one?
Yeah, 1 to 3
This
years.
one, 1 to 3 years. All of
Paragraph
them.
read
Before
करना
the shot, ask for numbing cream. Refer to first row above. Giving your child breast milk or formula or given a pacifier. Giving the shot, feed your child breast milk or formula or given a pacifier. Describe your child with a toy. After the shot, feed your child breast milk or formula or given a pacifier. Hold or rock your child or
अच्छा पाकिस्तान का दुकानदार
Le.
And 3
Lo sunt
years
în
and
activități, mă.
older. Please read loudly.
Printa băs.
Before the shot,
Explain our
ask about
specific
the
data.
breathing to first row above. During the shot, distract your child by talking to them, helping them to do breathing exercise or playing music or a video. After the shot, give pain relieving medicine based on your doctor's instruction. Refers to the first row above.
Thank you. Okay,
समझना एक दिन
chile
do you know?
दमावन
Yes, Damovan. And this?
سی و سه پول
رفتی دستان ها؟
پول سی و سه
رفتی؟ This immunization program is very, very important, and please read it carefully. Immunization program for your country.
for paper or
Yes, for example. For example. And this is very, very important. And know the names of the vaccine and the time where the vaccine administered and injected. And these are very, very important. And go to the WHO site and check the recommendation to administer vaccine for each people and
Khana, we should not study the vaccination plan in Iraq or in other countries like we are from Pakistan. And how will you make exam?
How are we supposed to study?
you know your country. حالا یه جوری اگزامش هم میگیریم دیگه آقای
نه exam این چارگزینیه
اگزام تو 4 بازه. ببین من اصلا چیزی فعلا در مورد اگزامتون نمیتونم. خب حالا من یعنی اطلاعات کامل تو سامانه نویدتون براتون میذارم. حالا هم چیزهایی که باید مطالعه بیشتر داشته باشید